Welcome to Mental Health Momentum, a Silicon Slopes podcast. I'm Dr. David Morgan. I am a licensed psychologist and the Director of Mental Health Awareness here at Silicon Slopes. And on this podcast, we talk about mental health issues in the workplace and beyond and look for solutions as well. And I'll introduce my guest to you today, Jay Toby. Hello, Jay.
Hey, great to be with you.
Very good to be with you as well. Let me tell you a little bit about Jay. Jay has a background in syndicating individual investments across various asset classes, including real estate, private equity, and private credit. He has spent years cultivating exclusive relationships with key players in the investment world. With a mission to broaden access to private investment opportunities, coupled with a strategic vision, Jay identifies and capitalizes on unique investment opportunities. And with that, Jay is bringing his focus towards the underserved sector, recognizing the growing demand and critical need for accessible behavioral health services. He is committed to applying his financial expertise and well-established network to foster investment in behavioral health initiatives. By doing so, Jay aims to bridge the gap between capital and care, expanding access to much-needed behavioral health resources and facilities. His goal is not only to generate returns for investors, but also to make a meaningful social impact by improving the availability of essential health services for communities in need, which I think is amazing. We talked about that a little earlier before the podcast, and just how you had interests in kind of multiple areas and thought, you know what, I can blend all of these together and still help someone besides myself, right?
Oh, definitely. And I love what you're doing here. You know, Silicon Slopes is a huge name in this sector, and being able to push into the behavioral health and mental health vertical is really powerful.
We're both doing our part. Absolutely. Well, and I appreciate, Jay and I met at a town hall few months ago, and I appreciate you being here. So tell me about your interest in mental and behavioral health, because that's sometimes people have a personal experience with that. Sometimes it's just they just feel the need to do it. So tell me about that.
Yeah, I would say most of this industry has some sort of personal relationship with it.
Yeah.
And mine comes down to, in 2019, I decided to jump into the world of investments a little bit before that. But I said one of my first investments should be philanthropic, even though it was a for-profit drug rehab mental health facility, inpatient. And it was really aimed at helping the hardest hit, a lot of Medicaid, a lot of the like downtrodden individuals. And I really thought that was an amazing thing to do. And so I backed it. I sat on the board. I never thought I'd be as involved in this space as I am today. Throughout my, growing up, I've had a few friends commit suicide, and I think that's unfortunately becoming more and more prominent in society. And so that's my tie to the behavioral health space. I've never gone through, recovery myself or anything like that, but I just saw a huge need. We opened up right before COVID. I got a little bit more involved than the other members on the board. I would say I was younger than most of the other members on the board, so I raised my hand and said, through COVID, which hit most businesses hard, I'll step in and try to see if I can help. We really did well, restructured that company, and I just found a little bit of a passion project for, I always would come back even though I didn't need to. And so a few years ago, I said, what would it look like if I just pushed most of my chips into this space? And here we are today.
And it's interesting, you talked about how you've never, had gone through a recovery yourself. However, I'm guessing that as you interact with these individuals, you just find commonalities, right? I mean, because we all struggle with the same sorts of things, the same types of traumas or other emotional issues, and then they manifest in different problems that we have in our lives. Some people head into addiction problems. Other people don't head into addiction problems. But I found, just as I've worked with, the severely and persistently mental ill, I'm like, I can kind of get what's going on there just because I've had similar issues that have led me to different places, but there is a degree of compassion and empathy you can have, even though you haven't had the exact same experience.
It's very fulfilling. That's what I kind of enjoyed is I'm not day to day with our clients like the therapist, like the staff is, but it's super fulfilling to help someone come from one of the lowest parts of their lives and even just help them get a hand up or two is pretty rewarding.
And addiction is one of those where you can see, you can almost see the transformation in real time because, especially when they go to inpatient and all of a sudden they have this, it's almost like this oasis where they've got all the support they never had before. They're out of the circumstance that was, really strongly contributing to a lot of their decisions. And you just see them bloom in that circumstance. Yeah, it's been that it is fulfilling.
And I would say a lot of, what I've seen looking into this industry is that it goes hand in hand. Mental health, substance abuse.
Yep.
They're usually hugely, cross
Yeah.
all over themselves.
I don't think it's rare, and I've treated and evaluated like more than 15,000 people in my career and diagnosed all sorts of things. I can probably count on two hands the number of times I've diagnosed exclusively a substance use issue. There's almost always another comorbid issue like an anxiety or depression or something like that. And that
they use things as coping mechanisms.
Absolutely.
Like we all do.
Absolutely.
And I think it's really important to understand that, to say, hey, there might not, on the surface, it looks like this.
Right.
Once you dig a little deeper, there's some really underlying, issues going on there.
Yeah. Well, and I think that's why it's such amazing to do that. So, and we've talked as well about serving the Medicaid population, which for those who don't know, that's going to be the poor people, basically, people who don't have access to more, I guess, robust insurance plans maybe. And so it can be a challenge as well because this population is typically very underserved. What are the challenges you find in trying to reach that population?
Honestly, it's access to resources and their internal, their support systems. Mm-hmm. The system is set up how it is, and we get because it has to do a lot with reimbursement rates.
Sure.
And where people can get, support, especially in the state. There's some laws that talk about smaller facilities getting more reimbursement rates, which then naturally, if you want those reimbursement rates, you make smaller facilities. But if you have smaller facilities, then you lean towards making them as profit efficient as you can, which closes the door to more access for the people and everywhere in the sector, you look left, right, and center, there are massive log jams. There are people that need high levels, need lower levels of care that are taking up high level of care beds. Mm-hmm. And that's happening throughout this there's just log jams. They hit a road, they get on 60 person wait lists to get access to services, or that service just might not be provided in their area.
And part of the challenge with some of these underserved populations is just, like you said, that support system that they typically don't have. I remember when COVID hit, when I was living in Washington State, and I was serving mostly underserved populations as well, a lot of homeless populations, in fact. And one of the things that they had to have in place before they could make a referral to me was a signed consent form. But all the offices is closed. And so so the phones were open so people could call in and say, this is my problem, I need some help. They'd say, great, let's get you connected with Dr. Morgan. And then here was the process. They would mail them a paper form, which then they had to sign correctly with no errors and initial all the places, and then
if
mail
had the right address for them.
Exactly. And then mail back to the Department of Social and Health Services. And then once they received that, they could schedule the appointment. And you can imagine so many people fell through the cracks because most of them didn't even have addresses. And if they did, then could they get easy access to the mail? Could they figure out how to do that? Whereas if they went into the office, then they could sign here, initial here, and the appointment scheduled within a few days. I just remember thinking how inefficient the process was. Hopefully there's, COVID taught us a lot of things. So hopefully we made some adjustments because of that. But it's so true that the people that need services the most are, and oftentimes the least supported, and those who can access at least on their own. Do you guys have any solutions for that, just at your own level of what you do?
Yeah, we have case managers. And so what we're trying to do is we're really trying to put an integrated approach to the mm-hmm. whole sector, so we can take a client from detox through years of sobriety or working with them in their mental health challenges. Because it's not about, hey, we joked about this, sometimes people have graduations at day 60, but only really because their insurance ran out. And so how can we help them way past that? Because they're going to probably be dealing with this for years. And so we have some amazing case managers that really try to help that individual. I mean, we have just some stories of clients of people getting jobs where for some of their outpatient treatments, they have to wake up at early in the morning, then they're working long hours just to be able to provide for their families. Again, that's why maybe that's why they are on Medicaid, is because they're trying to get some, a step up. They're trying to work really hard. Do they really want to come to an outpatient, call it AA meeting or something very late at night when they're going to be up very early? So a lot of challenges in front of them.
Yeah. Well, and that's why you need that support system, like you said, like the case managers who can just be that encouraging person to say, maybe this is something you have to consider, or helping them structure their day differently or whatever it is, so they can, because 60 days is wonderful, but for a lot of these people, I mean, we're talking 60 months, before you're looking at real significant changes sometimes.
Now, I talk from kind of the founder visionary standpoint. So some of the things I'm going to say now is not in reality yet, but one of the things we hope to do at North Star is we see that as patients step down their level of care, meaning, like, for those that don't know what that means, when a client comes in, they might be in a very severe state, and so they need a higher level of care. And then usually what happens is you hope to move them and step them down on their level of care, so they're being more out in the community. They are getting jobs while still having support. But what we've realized is there's all these funding gaps, all over the place. And so we did make a nonprofit to try to fill some of those funding gaps. One of them being that long-term support. Is insurance paying for someone to come stop by your house and just see how you're doing? No. And so no one's doing those. Aftercare is something that everyone in this industry is trying to figure out. We're trying to figure it out a bit through, again, our nonprofit and putting it in place there. And hopefully we can take it to the state or to insurances and say, look, we have been having good outcomes. We've been funding it ourselves through investor dollars or through donations. And this is the statistics and data we have here. Do you want to help offset this? And let's go find more support and better outcomes.
I think that's amazing, because aftercare really is, I'm trying not to be hyperbolic, but it might be the most critical part of this.
That's what I saw. And that's like the place where there's the least amount of funding.
Yeah, agreed. Well, because we are more interested in crisis management. We put out the fire, and then we feel great for putting out the fire, and we should feel great for putting out the fire. But then we talk about fire prevention, right? Then what are we going to do to make sure fires don't start again? And that's the challenge, is because it's, I don't know, maybe it's less, people can't see results from it right away, because the result is that nothing happens. Right. I mean, that's the evidence, right? The evidence is that there is no fire.
A lot of our systems, call it the medical system, is reactionary versus proactive.
Right.
And I think this space is another space that's very reactive, not as much proactive.
I think as human beings, we're more reactive than proactive most of the time.
That is very true. So that's probably why we create systems that way.
Exactly.
Maybe AI can help us with that, with being more proactive.
We wait till we feel sick to do anything about our medical health, right? And then instead of thinking, well, I feel fine right now, what could I do to feel fine longer, right? But for whatever reason, that's just not in our culture, or who knows? I don't know. Yeah, maybe
that's
AI,
a bigger cultural issue we're not going to probably deal with.
So as you've dealt with, so obviously in your space, you're dealing more with physical addiction. People are coming in for chemical dependency issues and that. What about kind of non-traditional addictions? Just interested in your thoughts on them, like pornography addictions, digital addictions, things like that. Do you guys have ideas for any of those sorts of things, or?
Yeah, and I'm not licensed, and so I'll leave that conversation with you and other therapists on this podcast.
Absolutely.
But my personal opinion comes from, it's really been interesting to see some of those non-traditional addictions happen. I think no one planned them. Let's call it social media. Wasn't planned to say, we're going to make this mousetrap that everyone's going to fall into. I think they created a vehicle that happened to take a lot of attention.
Yeah.
A great documentary is that one on Netflix.
The Social Experiment, or
yes, on Netflix, if you type in social media, or if you Google it, you'll get a great, And it really taught, if something's free, usually you're the you're the product.
Exactly.
And so I think, again, it was an outcome of attention. We're in an attention economy right now. And so wherever people's attention are, people are going to try to monetize that. But the issue with that is if you create a business in that space, what is their goal? Their goal is to keep your attention longer, better.
Right.
And so they're going to, whether they know it or not, build systems and processes to that end, which creates a lot of the issues we see today. I mean, I've read just in the last few days a handful of these young kids that get on and message people in video games, and they go and try to meet them in real life, and then they get snatched.
Exactly. Yeah. It's absolutely a problem, and I think you're right. I don't think there was necessarily any nefarious intent at the beginning. I think it was probably, I don't know if you can compare it to the tobacco companies. I mean, there was a time in our nation's history when people thought that was fine, and doctors recommended a cigarette, and that, and they thought, and then we started to realize, well, wait a minute, maybe this isn't healthy, and then of course there was some conspiratorial stuff of people suppressing evidence and that, and I'm not saying anything like that is happening with the social media, but now that we're aware of it,
same with the cigarettes. I'm sure once we get the social media, and once we put guardrails on there,
right?
Just humans naturally will find something else. There will be something else that our kids or grandkids will be talking about.
You're absolutely right. It is human nature it's human nature to fall into the mousetrap, right? To go for the cheese. And like you said, sometimes we end up building mousetraps. We don't realize we're mousetraps. And then later we're like, oh, dang, this is a mousetrap.
Yeah. I mean, how many years have we passed the founding of Facebook?
Oh, absolutely. Yeah. And it's really only in the last 5 or 6 years that there's been more and more data and concern about how this is affecting particularly adolescents.
And what I do love is what you just mentioned. There is more focus on this.
Yeah.
I mean, I was really young in 2008, but I use that as an example of saying no one would be talking about these issues then. You'd be sweeping it under the rug. We couldn't have built the whole business around this idea if the social, the social space was not where it is today. And people were willing to have those conversations, willing to be more open. And I do think that does have something to do with social media. It's taught everyone to be a little bit more sharative,
sure,
of their life.
Yeah.
That's not the right word, but
it's a brand new word here on the podcast.
Yeah. Charitable.
Oh, there you go.
They will share their intimate life a little bit more than you would back without that. So there are pros and cons on both sides.
I think so as well. And I think that connection is a critical means of just promoting mental health in general. And we find that in addiction recovery all the time is when they can connect with someone, it makes such a huge deal. I mean, the 12-step program, which is probably the most effective free program we have out there to deal with addiction, is all about connection. It's all about meeting with other people and getting sponsors and those things, and feeling like, okay, there's someone out there that cares about me. There's someone I can talk to about this in real time, someone who's been through the same issues.
And what a good point, because a lot of these things that we talked about, the non-traditional addictions, are all about isolation.
Absolutely.
You're isolating yourself away from people. You're not interacting, maybe call it intimacy, with another individual.
Right.
So a lot of it is the isolation where, again, I think some of the solution, we're social creatures. We need a tribe, whatever that be.
Well, and they create a false sense of connection, which then kind of derails what we should be getting from the true connection. And I was just thinking about that as far as chemical addiction, and it's the same sort of thing, because the neurological experiences that are happening when someone abuses chemicals, we can have those experiences. You can get natural feelings of dopamine, you for doing good things, exercising and other things, and having loving relationships. All of that can create a euphoric feeling in our minds. The drug just does that automatically without you having to invest anything. All you have to do is smoke or inject or whatever it is to have that experience. Same thing with these digital addictions. We feel like we're connecting. We feel like we're having this intimacy, but we're not. And so we're getting our cups constantly filled with vapor, and then wonder why we're so thirsty at the end of the day, right? Because we haven't drunk anything.
What a great line. You need to trademark that.
That's a good one.
Yeah.
So as far as you've run companies in that, and we talked about this earlier as well before the podcast, what can businesses do to promote mental health in their organizations? This is kind of a departure a little from what we've been talking about, but what do you think? Because people bring mental health to work now. This is, well, you see it in your businesses. A lot of people that work at recovery facilities haven't had experiences they're in recovery themselves. And
which
sometimes
is why they're trying to give back oftentimes.
And oftentimes they're the most amazing people as well, because they've walked the walk. But at the same time, they've had those vulnerabilities in the past, they've struggled with those mental health things. So how do we address this in a business idea?
Yeah, I think the biggest thing is to just focus on your employees' mental health. I think it'll pay dividends. And how you can do that is there's lots of resources through most insurances.
Yeah.
They can work with the insurance providers you usually have a mental health for companies. I would reach out to whoever you're using for HR, whether it's internal or external, and see what they have for your employees. And just usually people will come, they can do trainings for free. They can hire consultants like yourself that are really experts in this space. And so I think they need to head off those conversations early.
Yeah. It reminds me of the old parable, I guess, of the people are walking by a river and they see all these people in the river that are drowning. And so they're fishing them out, one by one. And then finally, one of the people is fishing them out stops and starts running. And they say, "Where are you going?" He says, "I'm going to find out why they're falling in the river." He's running upstream, right? To figure out why people keep ending up at this spot. And I love that analogy because, like we talked about before, we do tend to be reactive as human beings. And then that reflects in all of our other things. And maybe it just takes more energy to be proactive, or it takes more intentionality, not more energy, but intentionality, because when you're sick, you're automatically motivated to go to the doctor. But when you're healthy, you're not necessarily motivated to think, what kind of meal should I have tonight? Or should I exercise this morning?
And I get told all the time, we get a lot of mental health apps. I get shown a lot of mental health, everyone's got the next best mental health app in the entire world.
That's right.
And so I really hope that, and when I talk about that, we are more focused on the physical facilities, getting people, at some point, if someone needs to, I get, go talk to a therapist, talk to BetterHelp is a good resource, talk to people, but there will become, a lot of people oftentimes need to check in somewhere, just get in. That's where we live, is kind of the end of the road solution. And so I tell everyone, I hope that someone can come up with a solution that's way ahead of us. When I talk to all these tech entrepreneurs, Silicon Slopes is full of them. And I hope it brings more of a spotlight on mental health and what the initiatives that you guys are doing, that sometimes or someday someone can come and put us out of business, make an app, make something that is the cure. But until that point, I don't think there is a silver bullet, and we all are trying to lift this problem together. We're really trying to gather the data. We're very hands-on with the clients, and so there's a lot of great information that can be gained from what we are doing.
Yeah. Well, and I think, to go back to the river analogy, there's always people that are going to fall in the river. We're never going to be able to stop the people from falling in the river, but maybe we can reduce the number of people that fall in the river.
That would be the hope,
right? So that there's fewer to fish out at kind of that secondary and tertiary level where you guys are at,
and there's more nets upstream.
Exactly.
Hey, let's not let them get to the waterfall and over it. And that's the system we have. People are
exactly. You guys are built at the bottom of the waterfall.
Yeah. People are. I tell people all the time that sometimes we're not in the life-changing business. At this point, we're just in the life-saving business.
Absolutely.
If you're on a 100-person wait list and the person at 101 gets critical and they try to commit suicide and they get seen, pushes you down to 101, when are you going to get seen?
I know.
When you get critical.
I know. Well, we've identified the problem very well today, and we leave it to our listeners to find the solution. How about that? Everyone else, go figure it out. But we'll be there to support you upstream and downstream, right?
A rising tide lifts all boats. If you want to join in this industry, it's a wonderful industry. You help a ton of people. It's very rewarding. Again, maybe you might make the next best mental health app, or if you have a solution to some of the other social dilemmas, I encourage you to go out and try. That's where I started is I never thought I'd be in this space. I saw an issue, I saw a solution, and that's what we're really going after.
Jay, thank you so much for, number one, for sharing your thoughts here, and number two, just for what you're doing to help this population, and it's just in critical need. Every person that gets fished out of the river, they have you to thank, and many others as well. So thank you for what you're doing, just on behalf of everyone who suffers. So,
well, thank you for bringing a spotlight to this, because that's so important. It's just bringing a spotlight to this industry.
Thank you. Thanks for listening today. Remember that change starts with you, and together we can increase our mental health momentum.